Part 4. Rehabilitation after a total hip replacement. Rehabilitation after your surgery is now mostly self-directed. That means you'll be doing your walking and exercises on your own or with help from your dedicated support person. You won't usually be referred for ongoing physiotherapy, but you'll be given clear guidance on how you can progress with exercises and walking. You can always get in touch with the therapy team if you need advice. If it is felt extra physio is needed, you'll be referred to an outpatient physiotherapy department locally. It can take up to a year to fully recover, and you may have some swelling for up to 6 months. That's completely normal. Just follow the steps in your hip replacement booklet to keep yourself on track. Once you're home, take things steady. It's tempting to try and get back to normal straight away, but pacing yourself is key. Start with meals you prepared in advance, or those that just need heating up. As you feel stronger, you'll manage more time on your feet and get back to cooking properly. Avoid carrying hot food or drinks while using walking aids. When getting dressed, sit down somewhere safe. Dress your operated side first and undress it last. Bend only as far as feels okay and use tools like a long-handled shoehorn, sock aid or grabber if needed. Loose, easy-to-do-up clothes will make things simpler too. When it comes to washing, start with strip washes. Once you feel stable, you can start having showers. Don't take a walking aid into the shower, it's a slip hazard. Wait until your wound has fully healed before having a bath, and only if you're confident getting in and out safely. Leave heavy tasks like vacuuming until you're off walking aids and feeling up to it. You can drive again after 6 weeks, or when you feel fully in control and able to do an emergency stop. Check with your insurer before driving again. If you work and would like to discuss your return to it, then speak to an occupational therapist or your surgeon for advice, particularly if it is a manual job or involves a lot of driving. Whilst your joint can cope easily with walking, swimming and cycling, a return to more demanding, high-impact sports should be discussed with your surgeon or physiotherapist. After surgery, it's best to avoid long journeys. They can raise the risk of blood clots called deep vein thrombosis or DVT, especially if you're sitting still for a while. The most common symptoms to watch out for are swelling, throbbing pain, or changes in skin colour. If you notice any of these, get medical help right away. If you have to travel, take regular breaks to stretch your legs. Flying isn't recommended for the first 3 months, but if you do fly, bring your discharge summary to show that you have had a joint replacement, which can help with airport checks and X-ray machines. You might feel ready to have sex after 3 to 4 weeks. Just go with what feels comfortable and listen to your body. If you've been given any movement restrictions, keep those in mind. If you have any further questions, then you can speak to an occupational therapist on the ward or from the therapy office. The number is in the Total Hip Replacement booklet.